The World Health Organization has just declared Mpox a public health emergency of international concern. And to discuss this, its implication, we have with us senior virologist Dr. Gagandeep Kang. Dr. Kang is associated with Christian Medical College, Vellore. Thank you for joining us, Dr. Kang. We'll start by asking you, ma'am, please help us understand what do we know about Mpox so far and how big do you see this as a threat to public health?
Sure. Thanks for having me here. I think if people recall, a couple of years ago, there was also another outbreak of Mpox,
Mhm.
which went around the world, and it was very much in the news because the bulk of the cases at that time were actually identified after the outbreak had spread to Europe, right?
Right.
To generally wealthier countries. What's different about the outbreak now is that it has been declared a public health emergency of international concern when the bulk of cases, as before, are still in Africa. There is some migration to other countries, but there are about 14,000 cases that are occurring in the Democratic Republic of Congo, and there have been about 500 deaths that have occurred in that country. Um, Mpox is a virus that belongs to the pox virus families. We are familiar with smallpox, which is the only disease that has been eradicated so far. So, this is a related virus. It's an orthopox virus, a DNA virus, and there have been cases of this happening for decades. What we are seeing now is a virus that has evolved a little bit, and there is one particular clade of the virus that is beginning to spread in uh, being reported from many countries around the
Right.
world. This is the one that's predominant in DRC and is
Mhm.
now being seen elsewhere, Pakistan, in East Asia, Northern Europe. They've been having cases as well, but isolated cases. Very important to emphasize that these are very few cases that have spread outside of Central Africa.
Ma'am, like you mentioned, 2022, when the current outbreak first started, the understanding was that it was being sexually transmitted. What do we know about the transmission as of now, and how are the cases being managed? We also hear that there is a vaccine available. How widely is that vaccine available against the disease?
So there's lots of questions there. So let's first look at the epidemiology of the
Hmm.
virus, right? Which strain was it previously? Which strain is it now? Previously, so there are two clades of Mpox, clade 1 and clade 2, and then they have subclades within them. Last time, the clade that we saw was clade 2B. What we are seeing now is really clade 1 strains, and we have seen both 1A and 1B strains. Like 2B, which spread largely as a sexually transmitted disease, particularly it spread where people congregated a lot and they had a lot of relationships with other people and then took it back home. What we are seeing with this clade as well is that it is a virus that spreads sexually, certainly, but in addition to that, it spreads with contact. So that's why one of the worries with what we are seeing now is that this is a disease that is being seen in children. Usually, children were not
Yes.
as affected previously, but now we are seeing it in children. But the important thing to remember is that it's still prolonged and very close contact with people. So it would be very rare for this virus to spread with just casual contact with people. So, very important to remember that, because when we think about how viruses spread, obviously, if it is one that spreads predominantly with the respiratory route, it will spread very fast. That is not the case here.
So there is no evidence yet that it's getting transmitted through respiratory route.
So, right now, the evidence that we have is that the primary mode of spread is really close contact. Intimate contact first, close contact second.
Okay. Pam, I also asked you about, at the
Vaccine.
moment, how are cases being managed, as in what is the treatment modality offered to patients, and also if there is any possibility of vaccine being used against it.
Yeah. So there are drugs that are available to treat this virus. Tecovirimat is a drug that was available during the last outbreak. It's available now in limited supply. There are a couple of other drugs like cidofovir that can be used, but they tend to have much greater side effects. So, the major mode of management is really providing symptomatic relief because you have very itchy lesions, you have these papules, vesicles that can break down, so you have to protect the skin from secondary infections. And then people can have associated systemic symptoms as well. So, the idea is really to try and treat the symptoms as much as possible, give relief to the patient, and if you have access to the antiviral, then you can give the antiviral. You have to remember 14,000 cases, not all of them treated with antivirals. Many people were able to recover from that illness. So there is mortality, and currently with this strain, about 3% mortality. But in general, this is not a virus that kills everybody that it infects. So that's about treatment. And then coming to vaccines, the vaccines that were used for smallpox are also applicable to Mpox. There are currently two licensed vaccines available. One of them, made by Bavarian Nordic, they have just donated 200,000 doses of the vaccine to be used in DRC. But DRC believes that it needs much more vaccine and is asking for it. In addition to this, there are vaccines under development. The Coalition for Epidemic Preparedness Innovations is working with a number of companies, including BioNTech, in order to develop new vaccines. So, if we can have more vaccines and new vaccines, it will prevent spread of this infection.
Ma'am, like we mentioned earlier, WHO has declared this as a public health emergency of international concern. What are the implications of this move?
Well, I think the idea of declaring any illness fake or a public health emergency of international concern is to highlight to the international community that there is a need for all of us to come together, to share resources, to share data so that we can track the spread of the infection better and make sure that we have protocols available in order to treat patients more easily and also to deploy preventive measures like vaccines in an equitable manner. So, the idea is better access to drugs, to treatment, to diagnostics, to information where it is most needed.
Right. Ma'am, since 2022, India has also reported a number of sporadic Mpox cases. That time it was being called monkeypox. Do you see this with the current clade of the virus, in a position to trigger a major outbreak also in India, going
I
by the
don't think
epidemiology?
we
So,
will, I don't think we will see a major outbreak. I think we might see sporadic cases. They're likely to be importations, people who are asymptomatic, they travel and then they develop symptoms once they come here. So, this is what happened previously. It could happen this time as well. But I think the likelihood of widespread Mpox infections in India is extremely low. And as you know, everyone will know by now, the government is prepared to be able to diagnose cases of Mpox and to handle them wherever there are large airports, ports, etc., where imported cases can land. There is a degree of preparedness. that is sufficient for us to be able to handle any sporadic cases that might come in.
Every time there is a virus emerges, people generally tend to think, is there going to be another major pandemic? Because we have just recovered from COVID. We saw it in case of bird flu as well. The same question here, ma'am. Do you see it as a possible reason behind a global pandemic again in near future?
Well, you never say never when it comes to viruses and their behavior, but the likelihood of Mpox being a repeat of COVID is very, very small. So
That's
I think
primarily because of the way it transmits between people.
exactly. So I think we
Yes.
learned a lot about viruses and their behavior during COVID. And I
Mhm.
think it's really important for people to understand that it is the mode of transmission that decides how quickly a virus spreads. And in this case, the greatest likelihood is that we will only see sporadic cases.
Yeah. Okay, ma'am. Thank you so much for joining us today and giving us this insightful information. Thank you so much for being there.
Thank
Thanks.
you.